It's important that anyone who has a cervix, whether you are a female or you were born a female and now you're a trans man, any person with a cervix should have a cervical smear, depending on the age, depending on the frequency. Cervical screening is detecting changes well before you have any symptoms and usually well before you have any cancer. I think there's a lot of fear in women in general about their smears. They are scared it's going to hurt. They're not sure what the results mean. You have groups of people who are not sexually active, so it lowers their risk, but doesn't mean they're not having other sexual activities that increases their risk. Then you have people in same-sex relationships that think it's only passed between a male and a female. So I think there's a lot of misconceptions, and it's a lot around fear, and people think it's going to be a terrifying thing. It is uncomfortable, but it shouldn't be painful. And it's important to do it, I suppose, because we want to detect very early changes when we can do something and prevent it progressing.
You may recall back in April, the Minister and the GHA put out a big press release announcing that we were doing a big drive to try and increase the cervical screening. And we had a lot of women coming forward. In fact, we've had to ask people to be patient because we'd identified a large cohort of women that were sort of overdue their smears. So if you call the screening helpline, we can reassure you if you're due for screening. We can tell you when your last test was, if you're due, and we can get you booked in. At the moment, we've done over 70% of that cohort that we identified in April. And at the moment, we're doing the last cohort, which is age 50 to 65. Rather than miss anyone, we've just cast a wide net. So we're hopeful that we'll have invited for screening most of the population of Gibraltar between 25 and 70 at least. We've sort of extended it by the time the year is up.
Symptoms. Is it one of the cancers that you will have clear symptoms, or is it something that potentially goes undetected because of the types of symptoms?
Yeah, so it can go undetected. You could have no symptoms, and that's why it's important to have the smear to detect those early changes so you can clear the virus and you can treat early stages of cellular change. But symptoms when it progresses a little bit more is like change in your periods, bleeding between your periods, bleeding after sex, pain during sex. A non-specific one that we tend to kind of worry about if it's persisting is low abdominal pain or persistent back pain. And I can think of a few cases that have actually been like that in the last few years. If you're having bleeding after the menopause. So a lot of it is around bleeding and then lower abdominal symptoms. Obviously, it's a difficult scenario because you have female organs next to the bowel, next to the urine. So a lot of people will say, oh, I have IBS or I have lower back pain. So it's to know what your normal is so that then you can know what your abnormal is or what your new symptoms are.